All right, let's talk about your body's most critical plumbing system, your heart, and all the vessels connected to it. Today, we're going to break down three amazing procedures that surgeons use to fix clogs in these vital pipelines. We'll cover everything from what's basically a plumber's snake for your arteries to a full-on rerouting of blood flow. So let's dive right in.
It's a really important question, right? Because when the supply lines that feed your heart muscle get clogged up, the results can be really serious. We're talking about anything from crushing chest pain to a full-blown life-threatening heart attack. So when that plumbing starts to fail, how in the world do we fix it?
You know, the easiest way to wrap your head around all this is to just think of your cardiovascular system like the pipes in your house. Your coronary arteries are the pipes delivering that essential oxygen-rich blood. And when plaque, which is just a nasty mix of fat, cholesterol, and other gunk, builds up, it's literally like a clog in your kitchen sink, and it dangerously slows down that blood flow.
Now, before we get into all the cool high-tech fixes, you've got to understand that these are never the first step. The first line of defense is always going to be lifestyle changes, eating better, getting more exercise, and taking medications to control things like cholesterol and blood pressure. These surgical procedures are incredibly powerful for sure, but they're only brought in when those other things just aren't cutting it.
So let's start with the least invasive option, which, sticking with our analogy, we can think of as the plumber's snake for your heart. The official name for it is percutaneous coronary intervention, or PCI for short.
The whole point of a PCIA is pretty straightforward. Get that blocked artery open without having to do major surgery. So what they do is, a cardiologist uses a real-time X-ray to guide this super thin, flexible tube, called a catheter, from an artery in your wrist or your groin, and they snake it all the way up to the exact spot where that blockage is in your heart. And once they're there, they have this incredible toolkit at their disposal. If the plaque is really hard and calcified, they might use something called an atherectomy device. It's like a tiny little rotating shaver to basically grind it away. But more often, they'll do an angioplasty, where they inflate a tiny balloon to just flatten that plaque against the artery walls. And then, to make sure it stays open, they'll usually place a stent, which is like a tiny mesh scaffold. So check this out. This is how it usually works in action. The catheter gets the balloon and the stent right to the clog. Then the balloon inflates and it does two things at once. It squishes the plaque flat and it expands the stent. After that, the balloon is deflated and pulled out, leaving that stent locked in place, acting as a permanent support to keep that critical pipeline open. And get this. A lot of modern stents are even coated with medicine to help prevent the artery from clogging up all over again. It's just an amazing piece of engineering. So here's the key takeaway. PCI is the perfect tool for very specific situations. It works best when you have a blockage that's just in one or two arteries, and it's in a spot that's easy to get to. It is also, and this is critical, the go-to emergency procedure for quickly opening up an artery to get blood flowing again during a heart attack. But what if the plumbing problem is, a lot more widespread? What if you've got clogs in multiple places, or they're in locations that are just too tough to reach with a catheter? Well, that's when you need a major reroute. It's called a coronary artery bypass graft, or KBAG. With the bypass, the goal isn't to clear out the old pipe. Instead, you're just going to build a detour around it. Surgeons will take a healthy blood vessel, usually from the patient's leg, arm, or even from their chest wall, and they surgically attach it to the coronary artery, creating a brand new path so blood can just flow right around the blockage. Now, a bypass is not for small issues. This is for serious conditions. We're talking about when the main pipe, the left main coronary artery, is more than halfway blocked, or when you've got significant disease spread across multiple arteries. It's also the fix when there are blockages that a stent just physically can't get to. Okay, let's just put them side by side for a second. PCI is way less invasive, the recovery is a lot faster, and it's perfect for those simpler, contained blockages. CABG, on the other hand, is major open heart surgery. It has a much longer recovery time, but it's often the better, more durable long-term fix for really complex and widespread disease. It's really the difference between snaking a single drain and completely repiping your whole kitchen. This whole rerouting strategy is so effective that it's not just for the heart. Clogged pipes can happen anywhere in your body, and that brings us to peripheral bypass grafts. So when that same kind of plaque buildup severely blocks the major arteries in your legs, that's a condition called peripheral artery disease, your feet and your lower legs are literally being starved of oxygen. To fix this, and in many cases save the leg from amputation, surgeons do a very similar bypass surgery, using a graft to create a new highway for blood to flow all the way down to the foot. The warning signs of a clog in your legs, they often start with this burning, cramping pain when you exercise that just disappears when you rest. But as that blockage gets worse, the pain can become constant. Your skin might get cold and shiny, and you can get these really dangerous sores on your feet that just refuse to heal. Those are huge red flags that the circulation is poor and a bypass might be needed. Okay, so of course, with any major procedure, there are going to be risks. Now, this isn't to cause alarm, it's all about being informed. Let's look at a couple of the more serious, though thankfully less common, complications that medical teams are always watching for. One of these is called cardiac tamponade. The best way to picture it is to imagine the sac around your heart just filling up with fluid. That fluid puts so much pressure on the heart that it literally can't expand enough to pump blood properly. It's a true medical emergency, and they have to act immediately to drain that fluid and relieve the pressure. Doctors and nurses are trained to watch for a classic trio of signs for this one: dangerously low blood pressure, neck veins that are visibly bulging out, and when they listen with a stethoscope, the heart sounds really faint and muffled. Now, for any kind of bypass surgery, the biggest immediate worry is something called graft occlusion. This is when that brand new detour pipe gets clogged itself, almost always by a blood clot. Preventing this from happening is pretty much the #1 focus for the medical team in those critical first 24 hours after surgery. So for a leg bypass, this is what the nurses are checking constantly: the pulse in the foot, the color of the skin, and the temperature. Any sudden disappearance of that pulse, or if the foot starts to look pale and feel cold, that's a major red flag that the new graft might have just gotten blocked. The surgery itself is incredibly complex, for sure, but the long-term success of these procedures, well, that isn't just in the surgeon's hands. The patient's role in their own recovery is absolutely 100% critical. Recovery is a marathon, not a sprint. This timeline for a CABG patient shows how you gradually get back to normal life. It starts with just essential rest, then slowly adding back activities. And those lifting restrictions are a huge deal because it takes at least 6 to 8 weeks for your breastbone to fully heal and get strong again. And these right here are the keys to a great recovery. Little things like hugging a pillow against your chest when you cough, that helps protect the healing incision. But the real work is protecting the investment that's been made in your health. And that means committing to a heart-healthy diet, quitting smoking for good, and sticking with your medications and your cardiac rehab plan no matter what. Look, these procedures are nothing short of modern medical marvels. They save and dramatically improve countless lives. They're incredible fixes for a very serious plumbing problem. But it does leave us with one final, and probably the most important, question to think about. What can we all do to prevent our pipes from getting clogged in the first place?